Evening and welcome this evening to the Monongalia County Candidate Forum from West Virginia's Healthcare for All. I would like to make a few notes so folks understand what's happening this evening. I appreciate you joining. I want to let you know that first and foremost, we're going to be recording this. Second thing I would like to point out is that as we're going through this candidate forum, if you have questions, we do have a Q&A session at the end. So hold your questions, but please do put them in the chat. We will get to them in the order that they come through for all of our delegates. I want to speak to what the Healthcare for All campaign actually is. It's not an organization, it's a campaign. It comes from a variety of organizations. West Virginians for Affordable Healthcare, which I am the director of. I'm Jessie Ice, so welcome tonight. It comes from the CAG, which we call CAG affectionately, but it's the Citizen Action Group Education Fund, and also from the West Virginia Center on Budget and Policy. We are hosting tonight this candidate forum. We've got delegate and senator candidates from this region of West Virginia in order to hear their thoughts on healthcare. We have worked as a coalition for 3 years now. We're very proud of that we've been able to work this long and this hard on healthcare for West Virginians. Some of the things we've been able to achieve and work with are extremely important, and so I want to throw out a few of those. We were able to get an insulin cap for state employees to $35 a month, way before the federal government even did that. We were able to work towards dental benefits for our adults who are on Medicaid. We were able to work towards postpartum care up to 12 months for women who give birth, up to 300% of the federal poverty level. And at the federal level, we've been working on making sure that we passed and then continue the caps on copays and premiums. And then we've also had to work on, letting Medicare itself negotiate drug prices. So we've made a lot of progress as a collaboration. And tonight's candidate forum is based around healthcare for all. What do we need to do to make healthcare more accessible, more affordable, and more equitable for all West Virginians? I would like to introduce Gary Zuckett. Gary Zuckett is the Executive Director of West Virginia CAG and West Virginia my mind just lost me. Y'all have to apologize me. West Virginia Citizen Action Education Fund. It's a mouthful, but he will be our host this evening. We will be asking all of our candidates various questions. Gary will tell us the rules, and then we'll go from there. I'll be in the background, but please keep yourselves muted, and unless you need to speak. Please put into the chat any questions you have for our different candidates, and we will get to them as they come. So I'm really excited for this forum, and thank you all. All right, Gary, I'm gonna go ahead and pass it over to you.
Well, thank you, Jesse. And I want to thank the candidates that have agreed to join us tonight, and welcome the audience to our candidate forum on healthcare for all. As Jesse said, my name is Gary Zuckett. I'm Executive Director of West Virginia Citizen Action Education Fund and a partner in the Healthcare for All Coalition. And before we get started and before I introduce the candidates, I just wanted to lay out some of the ground rules that we'll be working under in this nonpartisan forum. And I just want to lift up the fact that all the candidates from the districts that we're participating in tonight have been invited both by email and by phone to join us tonight. And we are pleased to welcome those candidates that were able to join us tonight, and felt like this was an important thing. And did want to recognize that we had two candidates that could not make it tonight that had hoped to make it. Candidate Evan Hansen and candidate John Williams both had family health issues to attend to tonight, so evidently they will not be joining us, but we do want to invite, just want to recognize that they were willing to show up. And just wanted to say that all the candidates tonight will be given the same questions to answer. We will call on these candidates in alphabetical order, and we will rotate that order for each question. Candidates, once I get around to introducing the candidates, will be given a minute and a half for an opening statement and 2 minutes to answer each question, another minute for a closing statement, and then as time permits, we'll have some audience questions. And the timekeeper, which is Jude, who you can see, Jude Stevens, will signal with a yellow card when the 15-second limit is up. Here you can see him flashing yellow now, and a red card will be up when the candidate's time is over. So thank you for demonstrating that, Jude. And now we're going to go ahead and launch into things here. And I'd like to introduce our first candidate for their opening statement of candidate Katie Fallon, who's running for the delegate district number 82. Katie is from Deslow, West Virginia. So Katie, would you like to make your opening statement?
Sure. Thank you, Gary. And thank you, everybody, for putting this forum together. It's really exciting to be here talking about this very important topic. Just a brief introduction of myself. I'm Katie Fallon. I'm running to represent District 82 in the House of Delegates. District 82 is new, of course, like all the districts, and it extends from the Cheat Lake area to Baker's Ridge, north to the Pennsylvania state line. West Run Road is sort of the southern border of my district. I'm a mother. Healthcare is really important to me from that perspective. I've got 3 young daughters under age 10. I'm also an educator. I've taught writing at West Virginia University and Virginia Tech and elsewhere. My family co-owns a small business here in our district, and it is a veterinary hospital, so it's not human healthcare, but there's a lot of overlap. I'm new. I've not run for office before, so I'm learning a lot of this as I go, and I've learned so much already through this process, and I'm quite certain I'm going to learn a lot more tonight in this forum. I am passionate about being able to provide healthcare for all West Virginians, and I'm really honored to have the opportunity to speak to you tonight. So thank you for having me.
Thank you, Katie. We appreciate you joining us tonight and explaining a little bit about where the boundaries are, because all these districts have been rewritten, and So there's a lot of new business district lines to take care of. I'd next like to invite Representative Barbara Fleischauer, who is a longtime state delegate, who's now running for the Senate District 13. And Barbara is from Morgantown, West Virginia. Barbara, would you like to make your opening statement?
Hi. Yes, thanks, Gary. I'm rigging up my phone tonight because I have my computer being repaired and updated. And it's not working that well. But thank you, West Virginians for Affordable Healthcare and West Virginia Citizens Action Group. See, I got it out, Jesse, for hosting this important forum. And Healthcare for All, which is another group I think that was involved in. I have been a delegate for quite some time. I'm an attorney. I'm married. I have 2 adult children and 2 grandchildren. And I am very much interested in healthcare. I've been on the health committee longer than anyone else in the House, 26 years. And I've worked on a lot of different issues over time. I'm really proud of that. Unfortunately, I have all these years had to talk about abortion 6 or 8 or 10 times a year. And as our rights have been gradually diminished. And but I've also been able to help get a guarantee of insurance coverage for children up to age 18 with autism, and also to work really hard on the insulin cap. I think healthcare is really, really important. I think this is a great opportunity for us to talk and to listen, and I look forward to participating.
Well, thank you, Delegate Fleischauer. Our next candidate at the forum is a current House of Representatives member, Danielle Walker, who's running for re-election from District 81. Danielle, take it away.
Good evening, everyone. I am Delegate Danielle Walker, elected to the House in 2018 in District 51. And now I will be running in the new district of District 81, which is part of Saberton, up Hartman Run Road and part of Wiles Hills. I have a lot of student housing in my district, so I'm very excited. We've been working very diligently, registering new voters to vote. Now, a little bit about me and my journey of why I put my name on the ballot. It was simple, the events of Charlottesville and the intersectionality of healthcare brings on so much, especially in West Virginia. Our social economic class, the diversity in the LGBTQ community when we look of healthcare, our transportation disparities when we think about healthcare, especially in rural areas of West by God, Virginia. I am a mother, and I lost my son to leukemia last year. Now, when I think about healthcare and I think about the things that my constituents and my neighbors in West Virginians need throughout the state, it is definitely a priority. When I think about all of the healthcare reform that we introduce year and year after year in our state, and it never reaches a committee agenda, this is why I continue to put my name on the ballot. For something as simple as the Fairness Act. When we think about mental health, we have to make sure that we consider it healthcare. When we say reproductive justice, we have to make sure that it is reproductive healthcare. And when we speak about environmental justice, we have to make sure that we are considering the environmental pollutions that we have in the state and make that part of healthcare. So I am excited to be here and to start chatting. And I couldn't see you, Jude. I see you now.
Thank you, Danielle Walker. And that completes the introductions of the candidates. And now we're going to go ahead and wade into the meat of the day and the questions. Each candidate will, like I said, have 2 minutes to answer each question. and we'll rotate the order of the speakers. For this question, we'll start with Delegate Fleischauer, then Delegate Walker, and then Candidate Fallon. And the question is, on September 13th, the West Virginia legislature rapidly passed policy to make abortion illegal, with only very narrowly defined exceptions, all while 1 in 8 West Virginia babies are born preterm, and 14% of pregnant West Virginians do not receive adequate prenatal care. And 1 in 4 West Virginia families live below the poverty line. What are your plans to expand funding and programs such as SNAP, TANF, and Medicaid that provide vital services to support infants, children, and families? Delegate Fleischauer. Turn on your speaker, your mic. Thank you.
First, we need to talk about the abortion bill that passed, which will force people who are pregnant to have children against their will. Forced birth is what we were talking about. And some of those children, like my granddaughter, are going to be disabled. And I'm just so upset that my beautiful 8-year-old sweet granddaughter could be the victim of rape. She's nonverbal, and the idea that she could be raped and would have to report this rape within 48 hours. And then she would have up to 8 weeks to get an abortion when she can't even, she doesn't know anything more about giving birth other than baby dolls. And when she's 18, we don't know for sure, but it's likely that she's going to be the same condition, that she won't be able to talk. And I think she will still be rape bait. And it's just like nobody cares about my family's baby, and nobody has compassion for the children who are here and in difficult circumstances. And they're talking about the sanctity of motherhood in this ridiculous House resolution that passed. It was just horrible and demeaning and insulting to women. But I've been thinking about maybe we should, with this gigantic surplus that we have, maybe we should give all these people who are forced to bear children against their will. I mean, many of us have children because we want to. We should give them a stipend, just like we give in the Hope Scholarship. But I was checking around about the average cost to raise a child, and it's something between $13,000 and $16,000 nationwide. I don't know what it is in West Virginia, but that's what I think we should do with our surplus. And I would be interested in having a discussion about this. Thank you very much.
Thank you, Delegate Fleischauer. Next, I'd like to invite Delegate Walker to answer this question.
Thank you, Gary. Well, first, what we did on September 13th was absolutely embarrassing without having a study of maternal mortality rates and infant mortality rates in West Virginia. What we did on September 13th was radical. It was irresponsible, and it was neglectful. And the questions that you ask about these programs of TANF and SNAP and Medicaid, that's minimal. What about transportation? What about making sure that these persons have housing? We need to expand so many programs, and I think we need to remove the financial barriers of those programs. So how are we going to expand Medicaid? Are we going to have a waiver program for forced birth, for forced pregnancy and forced parenthood? What are we going to do when we have children or even adults who are victims of rape and incest, who has gone beyond those weeks? Because that's not an exception. That's a slap in the face of what we did in West Virginia. And we're not going to say hooray for that. It's absolutely disgusting. So we have a lot of questions. And as Governor Justice said, he didn't even understand the bill. So how is he going to understand any signage of anything to make sure that we are allowing West Virginians who are forced to be pregnant, forced to give birth, and forced to be parents? Anyway, how is that freedom? West Virginians and Mountaineers are supposed to be free. I see nothing free about an abortion ban, except for mental health issues, increasing the rate of poverty. And we have no answers to that. So how are we going to expand education? These are all questions that we should be asking the supermajority, and they haven't even thought about it. So once again, West Virginians fall by the wayside.
Thank you, Delegate Walker. Now I'd like to call on candidate Fallon to share her thoughts.
Great, thank you, Gary. And thank you, Delegate Walker and Delegate Fleischauer for speaking about this too. I share the concerns about the September 13th near ban on abortions, which was sort of rushed through in a special session without a whole lot of input, it seemed, from the public. I was there in July at the previous special session when there was discussion on this bill on the floor, and I was sitting up in the gallery, listening to women weeping and shrieking and being so terrified about the potential loss of essential healthcare in our state. So in many ways, the question about, how do we expand funding for these programs? I mean, it seems like we're going to have a lot of programs that we're going to have to find ways to fund because we're going to have so many more, potentially more kids in our foster care program, more families that have to apply for SNAP benefits. It seems like these are really big challenges that our state's going to face. And one of the reasons that I'm running for office is I feel like thoughtful people need to work on these serious problems to come up with, even if not solutions, at least ways to make them a little bit better. Something about that I know a little bit about. I'm the market manager of my local farmers market here in Cheat Lake, and I think it would be great if we can expand SNAP to make it easier for people to use those benefits at local farmers markets or even buying directly from local farmers. It's possible to do it now, but it's a little bit challenging. But I will maybe say more about that in a little while. Thank you.
Well, thank you, candidate Fallon, and we'll go ahead now and move on to our next question. And that is, we've talked to many individuals across the state who feel that they must turn down an opportunity to work or earn more money in order not to lose their vital Medicaid health care coverage. Other states are using federal dollars to address this Medicaid income eligibility cliff. Using allowed federal funding flexibility, West Virginia can create a Medicaid buy-in for lower income workers funded solely with federal dollars. Would you support a West Virginia workforce development program that would allow low-income workers who hit that Medicaid cliff to continue receiving Medicaid coverage through a Medicaid buy-in program? That's the question, and I'm going to call on Delegate Walker first on this one.
No thought given. I was one of those persons, and absolutely I would support that Medicaid buy-in. Until you understand that you finally have a medical procedure scheduled, you've already gone through pre-op 2 weeks prior, and you receive that call stating that you've made $7.47 over, and you no longer have insurance from your DHHR worker. And this worker is going above and beyond trying to figure out, do you owe student loans, but you was responsible and you paid them off? Do you have anything else that they can use? And it's just unreal. How many other West Virginians do we have in that same situation? We tell people often to pull yourself up by the bootstrap. But as soon as you have a little bit of funds to even buy a boot because you've been barefooting, then you lose something. It is time that we not only give West Virginians an option to survive, but having this Medicaid buy-in will allow so many families to thrive. West Virginia, it is time for us to move forward. It is time to put the people above the politics. I am so sick and tired of being called in because different corporations want to come into our mountain state and grow. And we can't even allow any growth for the people who has given blood, sweat, and tears for generations, or the people who were once transplants who decided to stay and have their roots here. So absolutely a yes on the Medicaid buy-in.
Well, thank you, Delegate Walker. Now I'd like to call on Delegate Fleischauer. Excuse me, Fallon.
Okay, I'm here. Yep, thank you. I agree with Delegate Walker that yes, I mean, of course, supporting a Medicaid buy-in here in West Virginia would be a great help to many. I believe we have federal funding available to continue support beyond the Medicaid cliff. And I would support this program to allow workers to hit the cliff to buy in. It's a solution to, it seems like there's no, I guess saying something is an easy solution is probably naive of me, but it seems like it's an easy, readily available solution to a problem with the current Medicaid system. So I would definitely support this program to allow folks to buy in.
Well, thank you, candidate Fallon. And next, finally, would like to call on Delegate Fleischauer to share her thoughts.
Thank you. I think that is a really important way for us to have a transition between the security of Medicaid and the cliff when you suddenly make a small amount of money and fall off and have no healthcare insurance. It's terrifying, as Daniel was saying. I have been a sponsor of the Affordable Medicaid Buy-in Program for a couple of years. In 2022, the bill number was 3001, and Evan Worrell was the lead sponsor from Cabell County. And it was a bipartisan bill. There were several Republicans that joined in on the bill. I won't be in the House of Delegates next year. I'm hoping to be in the Senate, and I would like to introduce that bill with other Democrats and Republicans on the Senate side, because I think it's creative. It works on a problem that is real, and it's pretty hard to. I mean, we have a lot of people who have traditionally in our country and in our state worked through illness and injuries because they were worried about losing their health care. So I think this is a great possible solution, and I hope we can try it out. Maybe we should make it a pilot program for certain counties to see what the cost impact is. I think it's a good idea. Thank you.
Thank you, Delegate Fleischauer. And we agree that healthcare is a bipartisan issue. Everybody needs healthcare, and so they're really these kinds of common sense solutions, I think, are a real positive move. On to our next question, and the next question is: in the 2022 legislative session, a bill was introduced which would have lowered the private insurance copay cap on insulin to $35 a month and add a copay cap of $100 a month on equipment, supplies, and devices. Congress passed a copay cap on insulin in the Inflation Reduction Act, but that cap only applies to Medicare recipients. The question is, would you support this or a similar bill to ensure that West Virginians with private insurance can afford needed health and insulin supplies to save lives and reduce tragic and expensive diabetes complications? And our first respondent will be candidate Fallon.
Thank you. And I realize, Barbara's here who was very instrumental in this, in that bill that passed that. I'm not sure who could argue against this. It seems like it's like a no-brainer. Of course, there should be, $35 a month cap on, an insulin co-payments and then the $100 for equipment and supplies and devices. I don't know why anyone would say that that's not a great thing to do. This is a debilitating, aggressive disease that requires constant monitoring, constant care. My father-in-law is diabetic, and it's something that, he thinks about constantly. And I absolutely would support this going forward. Absolutely.
Thank you, candidate Fallon. And so let's hear from candidate or Fleischauer, for Delegate Fleischauer, Senate candidate, and have her tell us what she thinks. Barbara?
Thank you, Gary. I feel very strongly about this issue. I was thrilled that West Virginians for Affordable Healthcare and other groups helped us get our first insulin cap bill over the finish line. For the last 2 years, we have introduced a bill that would, as you were explaining, it would add supplies to the cap, and it would lower the cap to be the equivalent of what it is going to be now for people that are on Medicare. The supplies part has me really excited. I found out that Connecticut had a bill that that created a copay cap for insulin pumps, which is a wonderful thing that can extend the life of somebody who is a type 1 diabetic, especially, and also type 2, and also continuous glucose monitors, test strips. When we went around talking to people about our first bill, we found out that people were paying $90 a month because, each little device that they had, they would get a new device and there'd be a new kind of test strips. So you wouldn't be able to use the ones that you used to have, and you would have to buy this new kind. It's just disgusting that insulin was discovered 100 years ago this year. And the people that figured out how to use insulin and so that it was good for humans, they experimented with animals first. They donated their patent to the University of Toronto for $1. And now we have 3 big companies that have a monopoly, and they are charging enormous prices. A copay cap was, I've heard about people that had $800 a month. We need to lower the cost of insulin, take away this monopoly, and have something more reasonable. West Virginia has the highest death rate from diabetes in the whole country. Connecticut, which had this other bill, had the lowest death rate. If Connecticut can do it, why can't we?
Thank you, Delegate Fleischauer. And now I'm going to call on Delegate Walker to give us her opinion.
We definitely should be falling in line, but I'm so proud to have Delegate Fleischauer lead this charge and take that caravan to Canada. West Virginia was the first one to do this. And we must give those accolades to those who took this journey to make sure that we were saving lives of West Virginians. I am not ashamed to say that last legislative session, I took insulin blindly because I could not afford my supplies. I could not afford my test strips. And when people say it's something as easy as your doctor just calling it into another pharmacist, what's the point if they're going to sit there because I cannot afford it? So we absolutely need to mimic, and we need to take a stance, and we need to be aggressive to make sure that not just Medicare, but all insurances are doing the same thing. This could be the start of healthcare equity. Equality is 2000 late. Yes, diabetics can go to the doctor. Yes, they can have the blood work. Yes, they can get the prescriptions. But what is the point when you can't not have the supplies needed to put them in your body? This disease is like no other, especially being in the state of West Virginia when we have substance use disorder. I found myself being self-conscious because I stick my fingertips so much of what someone was going to think of me. And you know what? I had to let that go. Think of me what you want. Because I stand with my neighbors that's fighting addiction. And you should stand with me of being a diabetic. So don't tell me it's easy as getting an insulin pump, because you don't know my pennies, and stop counting them. But understand that this is a priority. And we need to do better, West Virginia. Do something with the surplus. Now, enough is enough. You have the control of the Senate and the House, and you don't even give two hoots, not one, not even two, not even a half of one, about the people of West Virginia. If we could only all be like Baby Dog and get the care we need.
Thank you, Delegate Walker. Okay, question 4. The federal government is taking steps to no longer broadly subsidize free COVID testing, vaccines, and treatments. The cost will transfer to patients via their premiums and out-of-pocket costs. Do you see a future role for local public health departments to ensure that West Virginians can afford testing and vaccines? What would you propose to help ensure that West Virginians can afford appropriate courses of treatment for COVID? And I'd like to call on Delegate Fleshauer for the first response, please.
Thank you for that question. I think it's interesting that you put a focus on local public health department, because those people were really the heroes and the heroines during the whole pandemic. And of course, they still are. And they have lost a lot of their workforce. They have had as much stress as all the people in healthcare who were dealing with patients dying constantly. And we've lost a lot of our healthcare workforce. But I think it's really important to think about what local public health did for us, because they are the people that know about disaster preparedness. And we certainly had a disaster on our hands, and we still do to some extent. But I think it goes back to what we've been talking about a little bit, this gigantic surplus we have. We should infuse our public health departments with greater funds, because we have starved them. They had a 25% cut right before the pandemic. And we have restored a portion of that money, but we really need to thank those people for what they've done for us, and not tear them down like some people have done. And we need to make sure that we have the resources at the local level to test, because there are so many, I mean, like Danielle was talking about the drug addiction. I mean, we need to make sure we don't have other kinds of epidemics in association with COVID, like HIV. We've just got a lot of problems in West Virginia, and keeping them at bay is part of the job of the public health departments. And we need to make sure they have the resources they need. And so that would be a good use of part of the surplus.
Thank you, Delegate Fleshauer. I'd like to call back Delegate Walker to give her thoughts.
Well, each of you should know that this is something very near and dear to my heart as COVID-19 ripped through the African-American community between Mon and Marion County at the Brinks in 2020. And I worked very closely with some phenomenal individuals. So yes, our local health department should still be underneath a state of emergency. The coronavirus has not gone away, y'all. And we have a pandemic in the middle of an epidemic. We have the highest numbers of HIV and hepatitis, and our local health departments are leading the way. And they need that assistance and they need that extra funding to make sure that they're reaching out to the rural communities and the rural clinics. This by no means should be stopped. I was just in the pharmacist last week, and someone came in for a COVID-19 test, and it broke my heart. As Barbara and Evan and John, they were all by my side when we brought these testing sites all across West Virginia and volunteered their time by registering our neighbors to make sure that everyone knew their status. So how do we just throw that away? Especially when we have a surplus. Especially when we have cut our local health departments to nothing, but that's who kept us alive. That's who made sure that we had the real information, the solid medical advice of what we should be doing in the middle of this pandemic. It was our local health departments that did the contact tracing. It was our epidemiologists that we leaned on. Not just the COVID czar, not just the African-American COVID-19 task force through the minority office. So we definitely need to find the funding, and we need to find it now.
Thank you, Delegate Walker. And last but not least, I'd like to call back Candidate Fallon to address this.
Thanks. Yes, as Delegate Walker, Delegate Fleischauer have said, I mean, COVID-19, we know it's here to stay. We're still, in the midst of this pandemic. And I think that our local health departments, are going to become even more important now that the kind of federal support and guidance has begun to fade. Early in the pandemic, when I was first eligible for the first vaccine, I went to the Mon County Health Department to get that vaccine, and those workers it was like a well-oiled machine in there with getting the shot and doing the paperwork and waiting. And I think that making sure that this vaccine stays, accessible and easy for people to get is going to be really important, and county health departments will be instrumental in that. On Sunday, just 2 days ago, I was at the Chestnut Festival in Rollsburg in Preston County. And, it's outdoors, there's vendors selling things. I was there talking about bird conservation, and the Preston County Health Department was there with nurses at a table set up and just making conversation. I asked if they had given out many COVID vaccines, and they said, only a few. They said, why do you need one? And I said, oh, I don't know. When was the last time I had COVID? Or when I think I had my shot, maybe last October. And they said, well, you should sit in this chair. We'll give you one today. It's the new bivalent shot that covers the new variants. So my husband was there with me, and we said, sure. So we each sat in a chair and we got our new COVID vaccine, at the Chestnut Festival. And we did it because it was free and it was easy and it was friendly people right in your face at the county level. The nurse said, my name is Sheila, and she said, I give a good shot. You're not even going to be sore. And then they called me today and asked me how I was doing from the Preston County Health Department. And I think that continuing to fund these health departments is incredibly important. And I know that Jude has read, and Amendment 2 is the next question, but I'm concerned if this passes that services like county health departments could face a cut in funding.
Well, thank you, Candidate Fallon. And indeed, too, the next question does involve public policy on the ballot this fall. In November, West Virginia voters will be asked to vote on Amendment 2 that proposes taking 27% of personal property taxes that are currently protected in the Constitution that are used for local and public services, including critical health services, and will give the state legislature control over the appropriations of and the amounts of those funds. What will be the cost to our communities if we have fewer funds to invest in our schools and local public services? What is your position on Amendment 2? And I'm going to open it up with comments from Delegate Walker, please.
No, 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 absolutely not. We should not be defunding public education because of ego. Let's keep it real. We should not be defunding our first responders because that's exactly what it is. When you take from one place, you got to take from all. So what did education, public education, do to you that was so bad to where you just keep chipping at it every year, every moment that you can get? I can tell you the 2018 walkout, don't make me go West Virginia on you. What is it going to achieve? An uneducated population? We don't allow educators to educate in their classrooms now without making sure that they have to tick and tie and have check boxes, and all we do is test. Enough is enough. We have the best and brightest in West Virginia, and they deserve a great public education, and it deserves to be funded by the state of West Virginia. Enough is enough. And what else is this going to cut? What else? Have those uncomfortable conversations. Have you reached out to your county tax assessor's office? Because I can tell you, the paintbrush that they're using to paint with is invisible. It's going to cost more. It's going to hurt more. It's going to harm more. So please vote no on Amendment 2.
Well, thank you for your thoughts on Amendment 2. And now I will ask candidate Fallon to come back and give her thoughts.
Thank you. I also do not support Amendment 2. I think it's going to be bad for our local communities, our counties, and bad for our state. I'm going to be voting against it, and I've been telling everyone to vote against it. People have a lot of questions about this because on the surface, it seems like, oh, I don't have to pay my car tax anymore. But really, it's giving the legislature, the state legislature, the power to control the funding that the county needs for its vital services like education, fire departments, police departments, libraries, all those things that, some people, it might not funding the fire department, not giving them the funding they need. It might not be something people need to use every day because maybe your house isn't on fire every day, but gosh, if it is on fire, you really want there to be a well-funded, well-trained fire department. And education also, I feel like it's kind of death by 1,000 cuts for our public education. It makes teachers are having a more difficult time teaching because of the kind of orders coming down from the state. And we already have a difficult time competing with our neighboring states. Pennsylvania, Maryland, Virginia, all pay their teachers better than West Virginia, and they have better benefits packages also. So, I don't know why we always want to, maybe like Danielle Walker said that the walkout in 2018 this is a backlash from it, but Amendment 2, I do not trust the state legislature to have control over our county's funding for our vital services. So I will be voting no on Amendment 2 and telling everyone.
Well, thank you, candidate Fallon. And finally, would like to hear thoughts from Delegate Fleischauer.
Thanks, Gary. And thanks, Danielle and Katie, Delegate Walker, and candidate Fallon. I haven't really thought about how the impact of Amendment 2 on critical health services. I suppose it is going to have an effect on EMS. It's probably going to have an effect on our volunteer firefighters. And so I would consider critical health service. It's probably going to have effect on local public health, which has a very complicated funding system. It's from several different several different area sources. That's the word I was looking for. But it's just, I voted no. I'm going to vote against all 4 amendments. I think this is really government overreach, just like the abortion bill. This is just like, we know best and the current leadership knows best, and they can decide on these issues. I do not think we need to amend the Constitution for any of these amendments, and especially Amendment 2. I think the effect on public health or public schools is just horrible. The current majority is siphoning off funding with homeschooling, which can be done by a person without a high school degree, with money in the Hope Scholarship, with the charter schools, which will siphon off funding from our public schools to the tune of $7,000 per student. It will probably be a whole school in many counties. Which of your schools do you want to give up in your county? So I think it's a terrible idea. We do not need to give up local control over this critical funding. Includes healthcare, but also education, also law enforcement. We need a no vote on Amendment 2.
Thank you again, Delegate Fleischauer, for your thoughts on this. We are now at our 6th and final question for the closing statements. And this one's on health equity. Health equity means closing the gaps between privileged populations and marginalized or vulnerable groups of people. In West Virginia, vulnerable populations include women, people of color, people with a disability, immigrants, the elderly, people experiencing poverty, LGBTQ populations, and people without a high school diploma. What do you think West Virginia can do to advance health equity and reduce health disparities? And Delegate Walker is first up on this one.
Okay, I'm first again, Gary. I thought I was first on the last one, but we're going to take it away. In order for us to receive equity, we must truly be uncomfortable in meeting people where they are. When we speak about immigrants, we have to make sure that we are caring for their healthcare needs. We must make sure that there is not a fear of them being turned into ICE. We have to make sure that we are breaking down those barriers and stigmas. When we think about the care of the LGBTQ community, we have to make sure that we are educating physicians and nurses in diversity, equity, and inclusion. And we must make sure that we are not just using sex, but we are using gender identities, and we are respecting pronouns. We must break those stigmas. When we look at the African-American community and people of color, we must understand that those persons always seek a specialist, but not everyone has a primary care doctor. And we want doctors that look like us. We want doctors that understand the cultural connection. And until we can achieve that in West Virginia, and until we can attract those physicians that is going to make sure that they're just not caring for us medically and physically, but also mentally and emotionally, and that they're being respectful to our cultures. But we can do this in West Virginia. It is time to do this in West Virginia. We are 2000 late on doing this in West Virginia. And this is how I feel that we receive health equity.
Well, thank you, Delegate Walker. I'm going to ask Delegate Fleischhauer to join in on that.
Thank you very much. And thank you, Candidate Fallon and Delegate Walker, for your thoughtful responses. And actually, I want to thank this group of people that put this forum together, because as a result of that, I discovered that there was a Senate bill introduced on health equity. It was SB 59. And it had all Democratic sponsors, which kind of is an indication that it's not going to go anywhere. The Medicaid waiver and the insulin bill had sponsors from both Democrats and Republicans, and they did move, which was great. The insulin bill made it through the House, back to the Senate, and back to the House, and died on the last night. But it still was a real monumental effort on a lot of people, and there's hope for it to pass next year. Had an unrelated amendment added to it at the last minute. But on this health equity issue, Danielle was mentioning how, and I learned a lot about the African American community, because the first two people who died, one of them was a family member of someone that I know, were African Americans. And there was a celebration at a church in a very tiny community called Everettville. And it had a very tiny church, but 150 people were in it. And a lot of them got COVID, and many of them died. There was a group of people that came to celebrate the anniversary of the minister. And that is a tradition in the African American community, to go around to different churches and celebrate the minister's anniversary. I didn't know that. And as a result of that, there was a large bus of people in the choir from Fairmont. Every single person on that bus got COVID. And the first victim of COVID was on that bus. Really sad, elderly lady who had everything to hope for and continue living. So I think we all have a lot to learn, and having this bill that would have a pilot project on health equity would be an interesting idea, and I hope we can pursue it if I'm elected to the Senate.
Well, thank you, Delegate Fleischhauer, and I'd like to wrap this up with Candidate Fallon.
Thank you. And thank you to Danielle and Barbara for their great comments on this. Health equity this is a big, really important question. I mean, I believe that in general, healthcare should be accessible and affordable for, all people of our state. And these gaps in accessibility for the groups you mentioned are really unfortunate, and something that we should work towards closing those gaps. And as Danielle mentioned, these issues of health equity are connected to so many other issues. I mean, having a healthcare provider who understands what you're going through is very, very important. How recruiting and retaining doctors and other healthcare professionals to come to West Virginia is really important for addressing this issue too. But then how would you, if we keep making laws that remove accessibility to healthcare, how are we going to recruit folks to come here? I mean, a great example, is the abortion bill that we started this forum with. It's a step backwards. It's limiting access to healthcare. It's not going to be a great way to recruit or retain people to our state. I think we also desperately need to find a way to address substance abuse and the opioid epidemic in our state. And that's connected to health equity as well. So, big issues, and I'm glad that I've been able to join you all tonight and talk about them. I think that I think that comprehensive health services have to be recognized as a basic human right. You know, here in West Virginia and in the United States as a whole. I recently lost a good friend to cancer who had to pay for her treatments using GoFundMe. So it's doesn't seem like we should be doing that here in 2022. So thank you.
Well, thank you, candidate Fallon, and we agree that healthcare should be available to all, and we should all be working to mitigate and eliminate any disparities in the distribution and access to that care. Well, we do have time for a few audience questions. So if we have any audience questions, I see that Kat Stahl has a question. Kat, would you like to unmute yourself and introduce yourself and ask your question?
Sure, Gary. Sorry about the delay there. My internet connection isn't too good, so I won't show you my face. Also just got back from the barn, but I have two questions for these three truly amazing candidates, and it's really been so cool listening to you tonight. The two questions really relate to what Barbara raised about the current budget surplus. You know, what can we do with that so much? And also about a way I think we could help West Virginians be healthier and more productive who are on Medicaid. One is, would you support expanding the Medicaid dental benefit? It's capped at $1,000 right now, which doesn't go very far. And I think in the long run, we'd save money if we made sure that people have good oral health who are on Medicaid. And the second question is, would you support a comprehensive vision benefit in Medicaid? Thank you.
Okay, well, you heard the two questions. Let's just sort of take them as a two-part question. Do you support a Medicaid dental and Medicaid vision expansion? And the order for this will be candidate Fallon will be up first on this.
I would say yes to both questions. It seems like, you know, oral health care is healthcare. And as Kat mentioned in her question, you know, without good oral health, people end up with severe and extensive health problems. I mean, yes, I would certainly support that. And also adding comprehensive vision would also be a benefit that I would add to Medicaid. So many of our, yeah, I think that those were both things that I would support. Sort of, it's too bad that there is a cap that doesn't include, you know, dental over certain costs, and that comprehensive vision is not a benefit in Medicaid already. Yes, thank you for that question. I would support those.
So thank you for your opinion on that, candidate Fallon. And Delegate Fleshour, where are you at on this?
Well, first I want to say to Katie, I am so sorry about your friend. And it is just ridiculous that somebody would have to raise money for cancer treatments via GoFundMe. That's just a real tragedy for 2022. But I'm so sorry, and I suffer with you and for your friend and for all the people who are going without health care, like Danielle, because they can't afford it. But I think the issue about dental and vision is really interesting. I've been working on these issues a long time, and I used to say that everything above the neck is uncovered. And we got mental health parity while I was initially in the legislature. And the idea that we could ever get, this is something I'd have to give Republicans a lot of credit for. We had dental, we have dental for Medicaid for children, which is a wonderful thing to have that early life. You know, that's so important for your teeth to have good dental care when you're younger. But the idea that adults could get it seemed incredibly far out of reach. So I'm very proud that we were able to pass that. And vision, of course, seniors have it through Medicare. And I'm not sure about Medicaid and children, but yes, this is these are really, really important issues. But I also feel like we didn't say enough about how artificial the surplus is. I mean, I was speaking very sarcastically about this surplus. The surplus. These are false, misleading budget estimates that we're talking with, and I think the idea of a tax break, of any kind of tax break under these circumstances, is irresponsible, and we have to be responsible. That's one of the main things that our Constitution requires the legislature to do, is be careful stewards of the state's money. And given the economic situation with the OPEC gas boycott and what's going on in Russia, I think it's really hard. I think we have to be a little bit careful before we expand benefits. But these two things would really, really be important for improving the healthcare of West Virginia. Like Katie was saying, you know, heart disease is related to the bacteria that you have in your mouth, or can be, and you can have a heart attack and nobody could treat you because of your dental disease. So I do support these, but I also think we need to be careful with our money.
Thank you. And I'd like to call on Delegate Walker now to answer the question from the audience on the Medicaid dental expansion and addition of vision in the Medicaid. Thank you.
When we look at the cost of healthcare, it's no way that the Medicaid dental of $1,000 are going to cover anything, especially when you're thinking about and you're looking at adult dental health care. When we look at comprehensive vision for adults, it's only to a certain age with Medicaid. And even if a person has Medicare and Medicaid, they can still have an out-of-pocket. My mother is one of those persons, and she still has to pay an out-of-pocket when she seeks vision care, and it's not fair. And I want to go a step further and say we need comprehensive hearing. My mother needs hearing aids, and she absolutely cannot afford them. And there is not any programs out there with Medicare or Medicaid that she can apply for to get this assistance. So it shouldn't be an age barrier. It shouldn't be a poverty barrier. It shouldn't be classism for us to provide health care to every West Virginia in our state when we have this magic number of surplus. And we need to have those hard conversations, and maybe this starts out as a study to see what is the cost of dental care in West Virginia, especially when you look at rural communities. And it's one thing to move the cap to 5,000, but we need to make sure that those persons have transportation. We need to make sure that they have leave from work in order to get the dental care that they need. That's something we don't have as family medical leave here, and that's not equitable. So I will definitely support this. I appreciate the question.
Thank you, Delegate Walker. Well, that brings us to the end of the prepared and the audience questions tonight. Which brings us up to the closing statements for the candidates. And the candidates will each have 1 minute for closing remarks. And let's see, the order this time will be Fleshauer, Walk, Fallon. Let's see, I'm losing my place here. It would be Fallon, Fleischauer, and Walker.
Hey, Gary, there is another question by Mariah Plant.
Oh, okay. Well, I'm looking in the chat, but I'm not seeing it. Mariah, please go ahead, and we have time for another question. So please go
Hi,
ahead.
Gary. I'm sorry for wedging in here at the very last second. I want to thank again all the candidates who've logged on here tonight, and I've really valued your insight and the information you've shared with us. I wanted to share a little bit myself before I ask my question. I'm 27 years old, and I am a full-time caregiver to a family member with disabilities. I also think I might want to be a mom, and I want to do that and raise my kids in West Virginia. Delegate Walker and some of the other candidates touched a little bit on the abortion ban issue in West Virginia and the impact that has on family planning for those of us who are concerned that if we get pregnant, we might not be safe to follow through on a high-risk pregnancy should something come up that threatens our lives. I want to know, should I make it through a high-risk pregnancy or otherwise, and I do get the opportunity to parent a child in West Virginia, what, if any, legislation do y'all support that will help me be the best parent I can be, up to and including paid family leave, free school lunches, anything that could make it easier to be a parent in the state we all love?
Well, there you have it. You've heard the question. So we'll start this question off with candidate Fleischauer.
Thank you. And thank you, Mariah, for sharing your story and explaining how in every family we have complicated decisions that we need to make that relate to healthcare, and for giving us that angle. And I'm sure I speak for both Delegate Walker and candidate Fallon that yes, we support paid family leave and we support free school lunches. Actually, we've been doing some innovative things with free school lunches, using some benefits that have been available from the federal government. It's taken a while for us to get there, but in most counties in West Virginia, I think, especially during the pandemic, there were free school lunches available to everyone, so that you didn't have these collection of lunch fees and parents being in trouble for not paying and so on. So that seems like something basic that we ought to do, is make sure all of our kids get fed well during the school year. And paid family leave is something that we have introduced, and we've had some bipartisan support for that, but we're not there yet. And you know, it might be that we start with state employees, and I mean, it seems pretty obvious that, well, one, you ought to have sick leave, and two, you ought to have paid family leave, which is slightly different. Right now, if you work for a private employee, you don't even have sick leave. And that's pretty appalling for what is supposed to be the most advanced industrialized country in the United States. So I hope we can work with people like you and make it so that you can be as happy as I am about my daughter and my son and our family, because it is a blessing to have a family. So I hope you work through this in a good way for you.
Well, thank you, Delegate Fleischauer. I'd like to call on Delegate Danielle Walker to give us her thoughts next.
So I want to be as sensitive as I can toward my answer to the question, but being a mother who just lost a child who was an adult, who also had to do a GoFundMe to pay his minimum monthly bills. When I think about being a parent in that planning period, you don't plan for that. You don't plan if you're going to have transportation, but you try to seek and make sure that there is some stream of public transportation. that there is going to be a specialist that your child may need. You look at the school system. And so the bills that we introduce definitely is around pay equity. The bills we introduce is against discrimination of the Fairness Act and the Crown Act. The bills that we introduce is making sure that we have safe, accessible, affordable housing in our mountain state. And I also think that we have to have some uncomfortable conversations around financial planning. And that's something we lack in this state. And this is why it is so difficult for mountaineers to thrive. We allow these big corporations to come in and give us sprinkles of gold and fake diamonds. And they fill up these mountaineers' pockets, and we don't give them the tools they need for financial planning. And so I think when you think about financial planning and you think about healthcare, you have to have those uncomfortable conversations during pregnancy and childbirth. Where is your advance directive? Where is your medical power of attorney? Those what ifs becomes realities, and I just lived them a year ago. And so I think that is something that we have to continue to have a conversation and be uncomfortable in.
Thank you, Delegate Walker. And Candidate Fallon, would you like to share your thoughts on this?
Yes, thank you. And thank you, Mariah, for the question. I remember being, in that situation and trying to decide if it was a good idea to start a family. And I mean, that's a very personal, private decision. And one that's fraught with all kinds of anxieties, financial, spiritual, everything. I was sort of and I'm an old mom. I have 3 kids, but I didn't have the first one till I was 35. And I was concerned about, risks that could be associated with having children when you're old, like 35. And then I had 2 other ones, and I had my third one when I was 41. And I thought, I shared a lot of those worries about having a high risk pregnancy or not being able to become pregnant. And it was a stressful time. One of my concerns about the abortion ban is also has to do with the ability for our medical community in our state to deal with high risk pregnancies. I'm a little concerned that care providers may not want to come here to work on pregnant women because, they have, I can't imagine being a doctor trying to, what does the state legislature think about this procedure that I might have to, to perform, with this patient? So I'm worried that the abortion ban is going to impact other aspects of care for women. As Delegate Fleischhauer, Delegate Walker said, I mean, paid family leave, yes, free school lunch, and I think, and free school breakfast. My child's school, the kids get free breakfast too. And I think that's wonderful. Kids can come in a little early and grab their breakfast on the way to homeroom. I'm supportive of those things. So good luck, Mariah, with what you decide to do. It's a exciting and stressful time. Thanks for the question.
Mm-hmm. Well, thank you, Candidate Fallon. And I think we're now at the time for the closing statements. And we will have 1 minute for each candidate to make a closing statement. And we're going to start with Candidate Fallon, then Barbara Fleischhauer and Danielle Walker. So Katie, you're back on.
All right. So thank you again to all the partners for putting this forum together. And I'm excited to talk about these issues. And I sometimes, when people say, do you support healthcare for all? I mean, I sort of feel like just answering, well, yeah, of course I do, but the how you get there is a lot, is a lot more complicated. But I think, again, that everybody should have access to quality, affordable healthcare, and that, access to comprehensive health services should be viewed as a basic human right, Especially in 2022 when we have such great medical possibilities, such great medical care is out there. It's just not accessible to everybody if you can't afford it. I would support publicly financed, privately delivered federal single payer system of healthcare, and that was something that got me excited back in 2008 about Barack Obama's presidency, when that was one of the things he ran on, and he had some trouble, delivering on that. But until we can get there, I would support, reform that expands comprehensive coverage and access for everybody in West Virginia. So thank you again for letting me be a part of this.
And thank you, candidate Fallon. And you were right, the public option was one of the first things that got negotiated out of the Affordable Care Act, unfortunately. So we're still pushing for that. And next, Delegate Fleshour.
Thanks, Gary. And thanks to everyone who's listening to this either live or in the future. I have to say what a pleasure it was to participate with these two really thoughtful women, and that it was an opportunity for us to think about the how you get there. I enjoy the legislature because it is kind of like solving a mystery to figure out these solutions. And I appreciated Kat's question, because that's like, how could we work on these things, or both of her questions, and Samora and Mariah's too. So I appreciate the audience participation as well, because it makes us think, and it's enjoyable. I hope that I'm elected. I hope all three of us are elected and that we get to serve together. And I hope that we can turn things around and make things better for our state, because that's why we're running. That's why everybody runs. We don't all think exactly the same, and we have to do our best to work together. But thanks for this opportunity. And I learned some things tonight, and I hope we shared some valuable things tonight too.
Thank you, Delegate Fleshour, and Delegate Danielle Walker. You're wrapping it up.
All right. We have turned November into Rovember. The time is right now to vote, because your freedoms is on the line. The time is right now to support your neighbors with health care. Your time is right now to make sure that every West Virginia has an opportunity to get the health care that they need, that they deserve, not just to survive, but to thrive. I hope tonight's forum allowed you an opportunity to jumpstart your research of candidates who will stand with you and by you and for you. As we the people, it is our birthright. I hope that tonight's candidate forum will allow you to use your voice at the ballot box. Vote for Senator Barbara Evans Fleshour. Vote for candidate Katie Vallon, and vote for candidate Danielle Walker. And we have so many. My heart goes out to Evan Hansen and John Williams, who could not be with us tonight, but we have so many great candidates. Please continue to watch these forums and participate. Thank you.
Yes, and thank you, Delegate Walker. That reminds me that our final candidate forum will be next week in Kanawha County, and it will be on health equity and social determinants of health. And there's a link in the chat to to sign up for that. So that being said, I just wanted to say again that this candidate forum is being hosted by the Healthcare for All West Virginia Coalition. of organizations that includes West Virginians for Affordable Healthcare, the West Virginia Center on Budget and Policy, and West Virginia Citizen Action Education Fund. And at this point, I'd like to turn the program back over to Jesse to wrap things up.
Thanks, Gary. Thank you to all of our candidates, Fleshauer, Walker, Fallon. We really appreciated your participation in this forum and really sharing your views on what is one of the top issues for voters, which is healthcare. And like Gary said, we are a coalition of organizations, West Virginians for Affordable Healthcare, West Virginia Citizen Action Education Fund, and West Virginia Center on Budget and Policy. And we would like to extend an invitation to all folks to our fourth and final forum, Health for Kanawha County, Kanawha, if I said it right, and it's on October 18th, so a week from today. If you look into your chat for everybody, for those who are here, you can see a link to this forum, and we will be live and in person for it. However, you can tune in via our Facebook website. You can even Google Healthcare for All WV on our Facebook. And finally, I would like to put it out there, please vote. Voting puts your voice out there to our delegates and our senators so they know what it is you want. So please vote. And I would like to give a few dates to remember here in West Virginia. October 18th is the deadline to register to vote. October 26th through November 5th is early in-person voting, and for that, make sure that you bring an ID if you want to do it that way. November 2nd is the deadline for folks to be able to request an absentee ballot. And then we have November 8th, Election Day. I know it's not as popular as presidential elections, but it's impactful for our state. So everybody should get out there on November 8th and vote. Vote for what it is that you want for your family, for what you want for you. Polls are open from 6:30 a.m. until 7:30 p.m. And if you are doing a mail-in ballot, don't forget that postmark has to be by November 8th as well. I would suggest bringing your ID to any voting location that you go to, but remember your vote counts. It's important, and vote based on what you want for your family. If you look in the chat here, I see that Gary has posted a voting guide for West Virginia, and Jude has posted a link to observe our candidate forum, our last and final forum of this series, next Tuesday, the 18th. So I appreciate our candidates. I appreciate all of the organizations that work for this. And anything else, if I'd suggest reaching out on these links and doing that. So thank you so much.